Hello and thanks for coming. My name is Dr. Anthony Sensoli. I'm an ophthalmologist with TLC Eye Care and Laser Centers, which has been providing quality and state-of-the-art eye care to the local area for over 30 years. I've performed thousands and thousands of cataract and laser vision correction procedures since I've been in practice. Today, I'd like to discuss with you cataracts, cataract surgery, and the many options that you have available to you as a patient at this time. But before we meet for our consultation, I wanted to show you this video to explain some important aspects about cataracts and the surgery used to correct them. Your eye is like a camera. It has a lens cover called the cornea, a natural lens that does the focusing, and the film in the back is called the retina. The eye works by focusing light onto the retina, which provides your brain with a clear image. When your natural lens becomes cloudy, you may experience blurriness, cloudiness, glare and halos at night in your vision, difficulty reading. This cloudy lens is called a cataract. When you feel your vision is no longer satisfactory to do the things you enjoy doing, and we can't help you with using glasses or contacts, then you may be ready for cataract surgery. With modern cataract surgery, we remove your natural lens through an incision in the periphery of your cornea, which is less than 1/10 of an inch. We then replace your natural lens with an intraocular lens that looks like a permanent contact lens and will stay in place for the rest of your life. The entire procedure takes only about 10 minutes. Is performed with topical anesthesia and IV sedation to keep you comfortable. There are few restrictions afterwards, and most patients can return to work the next day. Before determining whether cataract surgery is right for you, I will perform a comprehensive eye exam to help me determine whether the cataract is the major cause of your vision loss. Other problems that may affect your eyesight are macular degeneration, glaucoma, or diabetic retinopathy. As part of the consultation, I will review with you whether these conditions exist. We will also perform today some special tests and measurements that will help us determine the correct implant to place in your eye. As a patient and consumer, you have many implant options available to you. You also have the choice of having a laser help you with your cataract surgery. If you have astigmatism, a toric lens, which is an implant designed to correct the astigmatism, can be used. Astigmatism is caused when the cornea, or lens cover of the eye, is not round like a basketball, but instead oblong like a football. The toric lens is designed to correct for astigmatism, giving you better vision without glasses. If you have no astigmatism, a monofocal implant may be your best choice. Most patients who choose a toric or monofocal implant are corrected for distance and understand they will need glasses for their near task, like reading. There are also implants that correct for both near and far vision for those who like to have the chance to eliminate the need for glasses. Finally, we also have a laser which helps us with the implantation, centering of the implant, and correction of astigmatism. This laser, which is driven by a computer, performs special incisions in the periphery of the cornea to eliminate astigmatism. It then focuses on the top part of the natural lens, making a perfect circular opening. It then uses laser energy to help soften and break up the lens so that when I perform my part of the surgery, I'm in there for a shorter period of time and it's gentler on the eye. And the laser performed incisions help increase your chance of having better vision after surgery. I encourage you to consider your options carefully. I also encourage you and your family members to ask me questions during our consultation. I look forward to our discussion and thank you for giving me the opportunity to help you.
Cataract surgery and/or implantation of intraocular lens IOL consent. What is a cataract and how is it treated? The lens in the eye can become cloudy and hard, a condition known as a cataract. Cataracts can develop from normal aging, from an eye injury, or if you have taken medications known as steroids. Cataracts may cause blurred vision, dull vision, sensitivity to light and glare, and/or ghost images. If the cataract changes vision so much that it interferes with your daily life, the cataract may need to be removed. Surgery is the only way to remove a cataract. You can decide not to have the cataract removed. If you don't have the surgery, your vision loss from the cataract will continue to get worse. How will removing the cataract affect my vision? The goal of cataract surgery is to correct the decreased vision that was caused by the cataract. During the surgery, the ophthalmologist, eye surgeon, removes the cataract and replaces the human lens with a new artificial lens called an intraocular lens, or IOL. Cataract surgery will not correct other causes of decreased vision, such as glaucoma, diabetes, or age-related macular degeneration. Most people still need to wear glasses or contact lenses after cataract surgery for either near and/or distance vision and astigmatism. What types of IOLs are available? Your ophthalmologist will help you decide on the type of IOL that will replace your cloudy human lens. There are IOLs available to treat nearsightedness, myopia, farsightedness, hyperopia, and astigmatism. IOLs usually provide either near or distance vision. These single-focus lenses are called monofocal IOLs. Some newer IOLs can provide for near, intermediate, and distance vision. These multiple focus lenses are called multifocal premium IOLs. IOLs that treat astigmatism are called toric IOLs. You can also have one eye corrected for near vision and the other for distance vision, a choice called monovision. What is astigmatism? Are there other treatments for it? Patients with nearsightedness and farsightedness often also have astigmatism. And astigmatism is caused by an irregularly shaped cornea. Instead of being round like a basketball, the cornea is shaped like a football. This can make your vision blurry. In addition to toric IOLs, astigmatism can be reduced by glasses, contact lenses, and refractive surgery, LASIK or PRK. There is also a procedure called a limbal relaxing incision, LRI, which can be done at the same time as the cataract operation, or as a separate procedure. A limbal relaxing incision, LRI, is a small cut or incision the ophthalmologist makes into your cornea to make its shape rounder. Any attempt at astigmatism reduction could result in over or under correction, in which case glasses, contact lenses, or another procedure may be needed. Need to stop wearing contact lenses prior to surgery. If you wear contact lenses, you'll be required to leave them out of your eyes for a period of time prior to having surgery to allow the cornea to return to their natural shape. What are the major risks of cataract surgery? As a result of the surgery and associated anesthesia, it is possible that your vision could be made worse. In some cases, complications may occur weeks, months, or even years later. These and other complications may result in poor vision, total loss of vision, or even loss of the eye in rare situations. Depending upon the type of anesthesia, other risks are possible, including cardiac and respiratory problems, and in rare cases, death. Although all of these complications can occur, their incidence following cataract surgery is low. Risks of cataract surgery include, but are not limited to, complications of removing the natural lens may include hemorrhage, bleeding, rupture of the capsule that supports the IOL, perforation of the eye, clouding of the outer lens of the eye, corneal edema, which can be corrected with a corneal transplant, swelling in the central area of the retina, called cystoid macular edema, which usually improves with time, retained pieces of lens in the eye, which may need to be removed surgically, infection, detachment of the retina, which is definitely an increased risk for highly nearsighted patients, but which can usually be repaired, uncomfortable or painful eye, droopy eyelid, increased astigmatism, glaucoma, and double vision. These and other complications may occur whether or not an IOL is implanted and may result in poor vision, total loss of vision, or even loss of the eye in rare situations. Additional surgery may be required to treat these complications. Complications associated with the IOL may include increased night glare and/or halo, double or ghost images, and dislocation of the IOL. Multifocal IOLs may increase the likelihood of these problems. In some instances, corrective lenses or surgical replacement of the IOL may be necessary for adequate visual function following cataract surgery. Complications associated with local anesthesia injections around the eye include perforation of the eye, destruction of the optic nerve, interference with the circulation of the retina, droopy eyelid, bruising, double vision, respiratory depression, hypotension, cardiac problems, and in rare situations, brain damage or death. If a monofocal IOL is implanted, either distance, reading glasses, or contacts will be needed after cataract surgery for adequate vision. Complications associated with monovision. Monovision may result in problems with impaired depth perception. Choosing the wrong eye for distance correction may result in feeling that things are the wrong way around. Once surgery is performed, it is not always possible to undo what is done or to reverse the distance in near eye without some loss of visual quality. Complications associated with multifocal IOLs. While a multifocal IOL can reduce dependency on glasses, it might result in less sharp vision, which may become worse in dim light or fog. It may also cause some visual side effects such as rings or circles around lights at night. It may be difficult to distinguish an object from a dark background, which will be more noticeable in areas with less light. Driving at night may be affected. If you drive a considerable amount at night or perform delicate, detailed, up-close work requiring closer focus than just reading, a monofocal lens in conjunction with eyeglasses may be a better choice for you. If complications occur at the time of surgery, a monofocal IOL may need to be implanted instead of a multifocal IOL. Complications associated with limbal relaxing incisions, LRIs, astigmatic keratotomy, AK. Limbal relaxing incision and astigmatic keratotomy are surgical procedures to reduce astigmatism. Some complications associated with these procedures are surgical perforation of the cornea, infection, overcorrection and undercorrection. In the immediate postoperative period, refraction may fluctuate. Additional surgery may be necessary to reverse overcorrection or undercorrection. If an IOL is implanted, it is done by a surgical method. It is intended that the small plastic, silicone, or acrylic IOL will be left in the eye permanently. If complications occur at the time of surgery, the doctor may decide not to implant an IOL in your eye even though you may have given prior permission to do so. Other factors, such as pre-existing conditions, may affect the visual outcome of cataract surgery, including other eye diseases such as glaucoma, double vision, diabetic retinopathy, age-related macular degeneration, the power of the IOL, individual healing ability, and, if with certain IOLs, the function of the ciliary focusing muscles in your eyes. The selection of the proper IOL, while based upon sophisticated equipment and computer formulas, is not an exact science. Any pre-existing refractive corneal surgery may affect your outcome. After your eye heals, its visual power may be different from what was predicted by preoperative testing. You may need to wear glasses or contacts after surgery to obtain your best vision. Additional surgeries such as IOL exchange, placement of an additional IOL, or refractive laser surgery may be needed if you are not satisfied with your vision after cataract surgery. The results of surgery cannot be guaranteed. If you choose a multifocal IOL, it is possible that not all of the near and intermediate focusing ability of your eye will be restored. Additional treatment and/or surgery may be necessary. Regardless of the IOL chosen, you may need laser surgery to correct clouding of vision. At some future time, the IOL implanted in your eye may have to be repositioned, removed surgically, or exchanged for another IOL. If your ophthalmologist has informed you that you have a high degree of hyperopia, farsightedness, and/or that the axial length of your eye is short, your risk for a complication known as nanophthalmic choroidal effusion is increased. This complication could result in difficulties completing the surgery and implanting a lens, or even loss of the eye. If your ophthalmologist has informed you that you have a high degree of myopia, nearsightedness, and/or that the axial length of your eye is long, your risk for a complication called a retinal detachment is increased. Retinal detachments can usually be repaired, but may lead to vision loss or blindness. Since only one eye will undergo surgery at a time, you may experience a period of imbalance between the two eyes, anisometropia. Surgery in the second eye can be accomplished once the first eye has stabilized to reduce imbalance. These and other complications may result in poor vision, total loss of vision, or even loss of the eye in rare situations. You may need additional treatment or surgery to treat these complications. This additional treatment is not included in the fee for this procedure.